Did you know a rabbit is the reason that we use titanium in dental implants? I'm Dr. Nate Farley, and I want to talk a little bit about the history of dental implants and what they are and what they can do for you. What are dental implants? A dental implant is essentially a titanium screw that is placed in your bone to support teeth. And that could be a single tooth all the way up to a full set of teeth. About over 100 years ago, dentists were looking for solutions to how can I help my patient who's missing their teeth? And they tried a wide variety of things, and it could have been something shaped like a screw or a plate. Even though they found some success, it wasn't really that predictable. What changed is that around 1965, there was a Swedish orthopedic surgeon, Dr. Brandmark. What he wanted to do is study blood flow, and he used a rabbit for his experiments. And to look at the blood flow, he had a titanium tube that was implanted into the rabbit's bone. He did his study, and at the end, he went to remove those tubes, and they wouldn't come out. They were fused to the bone. And the light bulb went off, and he started the first implant company that was using titanium for the implants, and it was a huge success because when we place titanium into someone's bone, it's a very biocompatible material, and the bone will actually fuse to the surface. And as they say, the rest is history. So when you look at dental implants, they have a very interesting history. Dental implants in and of themselves, they are just a titanium screw placed in the bone. The fusing happens, and then what comes next, okay? So you use a dental implant for a variety of reasons. Some people use it to replace a single tooth that they're missing, and then on the other end of the spectrum, some people replace a full set of teeth. When you have an implant here and you have your teeth here, it's very common that there's an intermediary piece, and they call that an abutment. And so those are kind of the three parts to implant dentistry: the foundation, that connection, and then the teeth, okay? And so that gives you kind of a brief overview of what implants are. And I want to just touch a little bit on what it is they do for you. One of the benefits of dental implants is that they prevent bone loss. If you have nothing in an area, you're going to lose bone. If you wear a denture or a partial that's putting pressure on your gums, you're going to lose more bone. See, when you have a tooth inside bone, and you're biting on things and you're chewing, it moves the tooth. And when it moves the tooth, it works the bone. And that working of the bone keeps bone. Well, when you remove that, there's no reason for the body to keep the bone, and that's why it starts to go away. When you put an implant into the bone and the bone fuses to it, and then you chew and you bite into stuff, it's working the bone again. And when you work bone, it stays. Just putting an implant in and putting some function on it is going to help you to keep that bone. Another thing that most people are looking for when it comes to dental implants is function. In our lives, we use our teeth for a lot of things, but mostly our teeth are used for eating food and also for speech. When you don't have your teeth, it does affect your ability to say certain sounds well. And so, but food is the number one reason that you want that function back. You want to eat whatever you want. You want to go to a restaurant and with confidence be able to order anything on the menu and be able to chew it. Dental implants can do that for you. And then the last thing is aesthetics, confidence. When we go out in the world and we want to talk and laugh and smile with people, we don't feel like doing that when we know that our front tooth is missing, or one of our teeth around the side but can be seen is missing, or if all of our teeth are missing. We don't want that. And so you gain a lot of confidence when you have a full set of teeth, and it's something that you feel good about showing the world. Thank you so much for watching. I hope you found that interesting. We have a lot of videos. Please watch another video to learn a little bit more about dental implants, and we hope to see you next time.